My name is Dr. Rohit Bhardwaj and I'm from Chennai. I've been practicing pediatrics for the last about 15 years and I do a lot of newborn and stuff. The other concept that we see very often is mouth breathing and snoring. Now, this is quite a question that we come across very well, and we have quite a few patients tell us that he snores quite regularly. Now, one of the important factors that we need to consider is how often this happens. Now, please understand the aspect that many children snore when they have a cold. Many adults snore when they have a cold. But what are we worried about? There are habitual mouth breathers, habitual snorers versus snorers when they have a cold or a cough. Now, habitual snorers are a kind of a different category as opposed to a temporary or an intermittent snorer. So, that kind of a difference needs to be ascertained. In terms of the reasoning for this, in terms of reasoning for someone who's going to snore and a habitual nose breather, one of the most obvious factors is to have a block in the nose. A block in the nose could be a mechanical cause, which could be something we call as a polyp or an outgrowth in the nose. Now, there again, there is quite a bit of confusion that happens because quite a few bit of school kids do come, or rather their parents come and ask us the doubt. Because remember that in our normal anatomy, in our normal nose, when you look into the nose, you do have projections on either side. Now, that is normal. When you have a cold, they get bigger in size. Now, that is different from having a separate outgrowth, A. Now, that is a job of an ENT. So, if you were to worry about a blocked nose, get him or her checked with an ENT specialist to confirm that there is no mechanical obstruction. Now, lower down, there's quite a bit of a myth surrounding this concept called tonsils and adenoids. Now, one needs to understand that tonsils and adenoids are a part of one's human body. Unfortunately, the usage of this term in our country, it means something very serious. So, people when they tend to use he has tonsils, I tend to tell them it's like having an eye and a nose. So, your baby is going to have a tonsil. Yes, it's a part of your body. So, what are we worried about? What we're worried about is the size of the tonsil. Now, there again, you could have a child with a very big tonsil or an adenoid and yet not have any problems with it. So, size merely does not show up as anything. So, in a habitual snorer, what happens is they usually have to get themselves evaluated thoroughly, where we look at the size of the tonsils and the adenoids, and we tend to make sure if that is causing any form of obstruction, and hence we tend to treat them. Now, these are one of the few important factors. And also, one of the other things that has been forgotten, albeit I have seen quite a few patients, are foreign bodies in the nose. Now, foreign bodies in the nose can stay for months together and parents don't recognize it. I have had patients, and even very educated patients for that matter. In fact, there was this child who was a 4-year-old, quite talkative and very well educated doctors, who came to me saying they had a very bad breath emanating from the nose. One of the first things that we think of, this in medicine is called bromhidrosis. One of the first things that we think of when someone has a bad smell emanating from the nose is to ensure if she has, or make sure if he or she has a foreign body in the nose. And incidentally, this child had a pen battery that was stuck in the nose for about 5 months and unrecognized. Now, you can realize the amount of trauma that can happen, because this child is going to go through multiple tests if the foreign body is not recognized. So, on the one hand, one needs to know what to do at the right amount of time, and doctors need to apply their paradigm to it. So, these are some things that we speak about snorers. Now, the other aspect that you need to understand is mouth breathing and snoring can be a part of one's life till about 5 years of age. And most experts will agree that till about 4.5 to 5 years of age, it's a part of growth, because the tonsils and adenoids normally shrink beyond that. However, if your child is going to have this problem beyond 4 to 5 years of age, then it needs to be evaluated thoroughly.